All right, thank you for staying with the Monday Report. The Town Hall Part 2 begins right now. We're still talking about the progress among adolescents and young people in HIV and AIDS interventions, but now we're going to talk about HIV and drug abuse. That is a substrata that we've not spoken about. This is what we're going to talk about now. Dr. Ruth Laiboni Masha is still with me here. She's the CEO, National Syndemic Diseases Control Council. Now joining me is Honorable Patrick Munene. He's the Vice Chair, Health Committee in the National Assembly. Also, Honorable James Nyikal is with us, member in the Health Committee in the National Assembly as well. And Honorable Anthony Kibagendi, Chair, Parliamentary Caucus on Drug and Substance Abuse. Thank you so much for making time. And Honorable Munene, I'll start with you on this. Today, I know you were out and about here in Mombasa, seeing the effects of drug and HIV and AIDS. What did you see as the Vice Chair of the Health Committee?
Thank you. Let me say we've been allowed today at the Health Committee the whole day. We were accompanied by people from Syndemic and the county government of Mombasa. Early in the morning, we visited the dens where people who use drugs, who are taking drugs really are based. And we saw the pain, we saw the agony and suffering of people who are seriously addicted to drugs. And the most painful thing and the most moving thing is that most of them, when you talk to them, they tell you they wish to come out of that addiction. From there, we went to Militini, where we went to the treatment center, where some of those people who have accepted that they have a problem have been taken in for the treatment program. Some are in for outpatient, others are in for inpatient. And looking at the trail of treatment, looking from the people we saw in the morning from the dens, to the people who are in the outpatient, to the people who are in the inpatient, you can tell that the program that is being undertaken is really helping and moving people from drug addiction. But we found there are so many challenges, the environment they are living in. You know, Trevor, what happens with the hard drugs, the heroin and the cocaine, it's not like beer. They are stimulants for sex, those who know heroin, cocaine, and so it moves together with HIV infections. Because if you, and even the syringes they are sharing, but we found that they are being helped with the needles for injecting themselves. So the environment really encourages HIV, spread of HIV, because men and women, they are sleeping outside, they are sharing the same floor where they are sleeping, they are young people. So it's a precursor for spread of HIV. Yeah. And mostly they are high. They are sleeping together and they are high on drugs. So it's a precursor for spread of HIV. But the program we saw today that have been put in place is a good program. Yeah. What we recommended as a committee is that the government really needs to invest in this program, because we saw the results. We saw somebody addicted. We saw people who are recovering. We saw fully recovered people. So we think it's a program that can work. It's a program that we really need to invest in. Yeah. And if you look at HIV identity in Kenya today, Trevor, initially HIV identity was mostly in older people, but currently the new trend is that HIV identity, the new cases are between 15 to 24, 25 years. The young people really are getting HIV identity. And we were discussing today with Dr. Nyikal before he came here, and we were saying maybe the biggest problem is young people, the younger generation of 15 to 25 to 30 years maybe. Yeah. They found when Kenya had really adopted HIV treatment. So they have never really seen somebody really sick on HIV. So they don't think it's a serious problem because they have never seen people really sick on HIV. Yeah. So we really need to increase the conversation among young people. We really need to create awareness among young people that HIV is still here. HIV is still with us, and it's still something we need to talk about.
Let me bring Dr. Nyikal on this. Doctor, how would you describe the situation you saw there when you're out in the field?
Well, the situation I saw is something one would not like to see. It is where they are staying, and as my colleague has said, they were called dens. First of all, I had objection, I still have objection to the term den, because a den is negative. I know it is true because they are there, that's where they stay, and they have access there. But I would use the word like high user sites, so that you give it a positive aspect. Yeah. So that's one element I saw. The other element I saw is that those people who are there, they actually have a problem. And I think the drugs probably may be the big problem, but it is a whole social issue because when we were there, one of the things that came about is they're saying, even if you get on medical assisted treatment, where you are getting this methadone, you also need to eat. So they were saying, we need food. When you are on this, you have an appetite. So they need food. The other thing is where they were saying the shelter is the problem of shelter. And there were even children, babies. So there is exposure to the elements. You looked at the area, there was a problem of hygiene, the sanitation in the area. So it is a whole complex area, and I wonder to myself that how safe is that place in the evening or at night. So I saw that, and when we went to the Miritini, we saw the people who are actually on a treatment, on outpatient, and then we saw the people who are inpatient. There's definitely a recovery process. But we also saw there are people, an organization which is dealing with outreach, which is actually giving a good link between out in the street and the program, which is Miritini. So what I realized is we really need to strengthen that link from where they are to where they're getting treatment. But it also came to my mind, what takes them to the street? Why are they there? Really, if you think about it, drugs are illegal, use of drugs are illegal. But here is a place we know people are actually using drugs. But it's okay. Is it okay? It isn't. It is just that they are there, we can access to them, access to them, they can also get access to us. But we need to really work hard on how do drugs get there. So what are the issues at home that bring them here? What are the security, let me call security issues that makes the drugs available, how the drugs get there in the first place. So then I saw the other thing is, there are a lot of government departments or sectors that need to be involved. The social sector needs to be involved, the health sector needs to be involved, the security needs to be involved, housing needs to be involved. So to me, I saw a whole complex issue. And then when we come to HIV, now it is a good entry point, but it must be in the context of that. And the fact that they are young people. And what he said, I think there are some of my colleagues we worked with here, in the crowd here. Young people have not seen HIV. They don't have a concept of what HIV is. When we started, bodies were being wrapped, and nobody was allowed to see when the body was brought. People were so thin. The picture of a person with HIV was not what you are seeing now, a healthy person who have said, I'm this. This was a thin, emaciated person who was dying. People were scared, and that scare was perhaps useful. I think that scare is gone.
But didn't that scare come with stigma as well?
Yes, it came with stigma. But now that we have removed the stigma, now we need to now get into more awareness of taking positive. You see, when you have stigma, it can drive you to treatment, but it also can stop treatment. But if you think it is okay, I think right now, when we are talking of, my colleague has said, when you take these drugs, you are sexually more active. Perhaps alcohol less, but with these other drugs, they're stimulants. People may be more worried, particularly the girls, of pregnancy than even HIV, AIDS. So that means now they need to be more aware, more motivated to say, no, I don't want to get things near me.
All right. So Kibagendi, what is the solution going forward? Because this falls almost squarely in your committee. What are you going to do differently now?
Thank you. Now, first, the caucus that I chair is not a parliamentary committee. It is an initiative by parliamentarians with the support of the Speaker and our clerk that is involved in creating awareness and in ensuring we strengthen legislation around matters to do with drugs and substance abuse. You know, users of drugs and banned substances become somewhat reckless in the way they conduct themselves in life, in society, you know, and that is how they end up either being careless when they are excited about having intercourse, or even when they use needles to inject themselves with drugs. And that is what has escalated the HIV and AIDS spread in our country. So what we are proposing, one is increased funding to the national syndemic, so that they expand the programs that they have. Of course, we have a bit of support from the Global Fund and other partners, but we need to increase funding as government into this particular program. Number two, we need to also increase funding to NACADA so that they also make a lot of noise, what we call advocacy and creating awareness. And of course, we have a lot of genuine and result-oriented CBOs and NGOs. Like here in Mombasa, we have the Reach Out program that actually they are the ones who took us to they call them Maskani, the areas Dr. Nikal wants to give a different name, a more fancy name, the hotspots. And they are the ones who actually, they even give them food. They're the ones who ensure some of them are actually transported to the treatment centers. They follow up. They do a lot of follow-up, and they work with community health workers. So what we are saying, we need to increase funding in creating awareness. We've heard before, they say that prevention is better than cure. And I tell young people, keeping off drugs is easier than getting off drugs. And again, to young people, like my colleagues have said, HIV and AIDS in the past when we were growing up was such a scary topic to even talk about. And it is time the national syndemic and even the various partners that they have, and everyone in society to start talking about effects of HIV and AIDS, as well as effects of abusing banned substances in our country.
Dr. Masha, what would be the longer-lasting solution to this? Because you're already dealing with a burden of just HIV. Now, if you add on top drugs abuse on top of that, where will you draw the balance?
So, I think, Trevor, the issue of drug use, especially injecting drugs use in this country, has reached a level where we are saying that we actually need to work differently. And that is why we are really working not without talking to the community, but when the people who inject drugs are actually the voices behind the solutions we have. And I'll tell you why. The problem, as you've heard from the members of parliament, is a complex problem. So sometimes it can be looking very frustrating when you work on that area for some time, and then when you come back, you realize that more people have come to the street. Either they have left their homes. One of the things that we found today, maybe you heard a couple of them, they spoke about what happened to their homes. They spoke about my father died. Some told you my mother died. People mistreated me. So there's something about the family social cohesion that is actually becoming a key challenge. When you met the women who inject drugs, the girls, when you interview them, they start again with pregnancy. I was rejected. Something happened, there's rejection. There's something that sends them to that level of or the peer pressure that comes in. The other thing, I think it's important for us to understand that drug addiction is a disease because it has symptoms. It has a chronic part. It means that the person who uses drugs or injects drugs requires medical treatment, at the same time requires all the elements that you've had, social protection, the decency housing you're talking about, the foods that we're talking about, because if we have to heal these people, we need to look at them in totality as human beings and give them dignity. That dignity is what is lacking. That dignity is what is lacking from the basis we saw. And before we dignify them, we can't be able to then deal with the problem at the end tail, because then indignified people then lose value, self-worth. They don't think they are worth being taken even through the treatment spectrum that we have. The other thing is what has been said, prevention. And it's very, very important that we begin to speak about drugs in a perspective that the young children in our homes understand. Parents' absence must stop, because when we are away from our children, and when being away, it doesn't mean physically away. It means we are there, but maybe on our phones. It means we are there, but maybe we are busy, but we are present. Because sometimes physical presence is not really the issue we talk about. It is being available physically, but mentally with your children, even if it's through the phone. So there's a lot of things that you can do for cohesive approach from the family, for prevention from schools. And then, of course, there's the whole spectrum of the drug supply issue that has been spoken about.
All right. I'm getting a question here from Pamela Sigi. She says, are we giving young drug abusers commodities such as condoms?
Maybe you can answer.
Maybe Ahmed can talk about that. And Ahmed, you have your microphone there with you. And also, as you speak about that, Ahmed, one of the other things that everybody keeps asking is, what is it about drug abuse that people don't understand? Because I've heard Dr. saying that most of them were saying, I wish I could stop.
Yeah, thank you so much, Trevor. And I think whatever is said has value in one way or the other. But I would say that as the people who use drugs, punishment normally makes us more sick, but compassion can make us better. So what people are trying to say is that everyone has a different approach. If you look at the issue of legality, we are told to be criminals because of the act that we are doing. When you come to health aspect, we need medical attention, not legal attention. So I think what people need to understand is that at the moment, wherever we are right now, based on the internet, based on so many things, as the people who use drugs, we've also been exposed. So you cannot actually plan a program for the people who use drugs if the people who use drugs themselves, they are not part of that program. I think also with the program that we have, you've had people getting into recovery and then relapse. The relapse sometimes is caused by the aftercare program, because drug use is one aspect. You might help me stopping it, but now maintaining that life without using it. How do I handle frustration when it comes my way? How do I handle breakups when they come on my way? So I think there is a lot of social and also economic factor that need to be injected, not just one aspect of the treatment, because that is one aspect. Secondly, I want also to declare, Trevor, I was the first daring character in Kenya to distribute needles and syringe when everyone was against it. Some of the programs have been given boxes of needles, but they could not go to the den and distribute them because it was hostile, everyone was against it. But now after sensitization, because it was the aspect of reducing HIV, we are talking about 18.7% for the people who inject drugs in Kenya. That's proportionately very high compared to the general population, which is 4.7. So I think those are the issues that really need intervention, that the people who use drugs themselves need to be in the table. Sometimes I like when people consider us based on policy, like say people who use drugs are sick people. It is true, but we are not sick in terms of we cannot sit on the table and make decisions that meant to us. And I like what my parliamentarians are saying, because these are issues of policy. How do we reclassification the policy? We might not have that, it might be a tall order to reform today the Psychotropic Act that we have, but we can do reclassification. We can compare costs on when you put someone in prison, how much does it cost than buying a needle or a syringe to prevent person from HIV.
Which is interesting, Ahmed, because you're saying something very interesting. When you decided to give syringes, there are those who argue that then you are then fostering that same drug addiction?
Pardon?
When you're giving out the syringes to the people out there, there are some people who claim that you're then allowing them to even use more drugs, and yet you're trying to cure the whole HIV transmission. What was your argument against that?
Yeah, and as I've said, Trevor, in this country we are giving, there are condoms provided. Condoms is one, apart from family planning, condom is also meant to prevent STI and mostly HIV, right? It is the same thing, because before then, Trevor, the WHO gave their projection. Like one person who inject drugs and they are HIV positive, they have a capacity to infect 7,000 people. And I know you will sit there and say, I'm not injecting, but this is what is happening. Today, I'm a handsome man. I inject drugs, and I have a wife, or I have a partner, you know. My wife also have a side boyfriend, and that side boyfriend has a sponsor, and that is how HIV is spreading. Coming from me, who is a person who injects drugs, I'm HIV positive, and I've not been taken care of a single needle that could prevent me from another partner. Okay. So I think when you look at health perspective, you will find it is crucial people to be given needle. Okay. However, we still have a law under Psychotropic Act Section 5. It talks about paraphernalia and all those kind of things. And that is one of the hindrance. Maybe we might be not progressing well. All right. In the other curves, we are talking about 18.3, Trevor, percent. Now we are talking about 18.7%. And I know the Kenya strategic framework is about to be reviewed in a semester. We might see the number keeping going up. Okay. So we need to review our strategy and our intervention.
All right, I will take a quick break here on the Monday Report. When you come back, we're still talking about the gains and the challenges facing the HIV fight against HIV infections, but that is coming right after the break. My guest will be heading out, and then they'll bring in a new set of guests to talk about the gains and challenges right after this. All right? See you shortly.